Good evening and welcome to Power Talk. I'm your host, Adrienne, and I appreciate all you guys out there in video land. Join us every week to learn a little bit more about something important in your world. And I've got some really personally important stuff that I want to share with you tonight, because my guest tonight is Angela Myers. Angela is an ARNP. She can explain what that is. She is my medical practitioner. And I was at her office this afternoon because I have no cartilage in my right knee, and I do not want to have that knee replaced. I found Angela, and she's been life-saving for me. So we want to share with you tonight some alternative solutions that might help you, A, not have to take steroids to reduce pain in your joints, and B, maybe leave joint surgery off. Maybe you might be able to push it off for a long time. Who knows? So welcome, Angela.
Thank you. I appreciate that.
Well,
and it's a pleasure to be here.
Well, you've changed my life. You know, you've given me back mobility that I didn't have before. And the solution that we use is prolozone. So can you explain to the viewers, what is prolozone?
Prolozone was developed by Dr. Frank Schallenberger, and he actually made his own Prolow injection. And some of you may have heard about Prolow injections. And he's made the Prolow injection, and then he adds ozone to it, which is an oxygen that has 3 atoms on it. And we use one shot to do that with. We can go into the joint. We can do all kinds of things with prolozone. Go into muscle. We go over organs to get the organs functioning better. It's really amazing. And what it is nutrients. The Prolow is nutrients, and the ozone is oxygen. And what Dr. Schallenberger says is that if you have pain, it's because you don't have nutrients and oxygen. So we're putting back the nutrients and the oxygen, and it's amazing.
And it doesn't hurt.
It does not hurt, and that's what we really like about it.
Yeah, that's the most amazing thing, because, you know, when I'm getting the injection, it takes, you know, like a minute or two for her to get the prolozone in there, and then to get the oxygen attached and put that in there. You know, and Angela's always asking me, are you all right? Are you all right? And I'm like, yeah. Today I was one with the butterfly that was on the other side of her wall, because I don't want to watch what she's doing.
Yeah, nobody likes to see a needle, that's for sure.
No. And I already have that white coat syndrome. Every time I go into her office, my blood pressure goes through the roof. But that's just what it is.
Yeah.
But so it appears to me that, I guess we've been doing this for about a year now. And I come in once a month and get the injection. And it appears to me that functionally my knee is a lot better than it was. How can that be?
Well, the prolozone and the oxygen, and the oxygen is delivered in an O3 molecule, and it's unstable for about 30 minutes, which is why we have to do the ozone in 30 minutes, because the body will accept oxygen in an O3 molecule or via ozone. And then when it gets into the body, it breaks off, and the body will accept that oxygen. But what it also does is that it regenerates cartilage, joints, ligaments, tendons, muscles. So it's really amazing stuff. And that's what's happening to your knee. And I think it's okay for me to talk about this, correct? Mm-hmm. When you first came, you were having a lot of difficulty walking.
Oh, yeah.
And when I did your exam, I felt a lot of crevitus, which is grinding between the joints. It's like a you know, that kind of noise. And now, today, after we did your prolozone, there was just not any at all, because it's repairing the joint. And you're not getting that grinding of the two joints grinding together. And so it repairs. It doesn't just take the pain away. It actually repairs the joint, the ligaments, the muscles, the tendons. So it's very amazing.
And so this replaces what a lot of people do when they have joint pain, is they go and they get a cortisone injection in their joint. And can you talk about what the negative effects of cortisone are?
Well, cortisone is given to relieve inflammation. And, well, it does that. But one of the things it does do is it causes thinning, or it can cause thinning of the joints and of the, the vessels and, all those areas. And so that's why they wait at least 3 to 6 months before they will give you another cortisone shot. Where with prolozone, we don't have that problem. We are, we can do the re-injections in 2 weeks. And the reason we wait 2 weeks is because we see a lot of improvement up until 2 weeks.
Yeah.
And we don't have to worry about, things like thinning of the joints or the tissues or anything.
And I find that the relief, well, it's instant, for one thing. But I come off your table and I'm walking around your office and there is no pain. But then it really holds for a month and maybe longer than that. I've waited longer than that, and that, to me, it began to maybe not be positive. So I've really I schedule my appointments every month now, just to make sure that I don't lose any of the benefit that I'm gaining. But what other joints does prolozone work well in?
We have done joints, I've done the dental joints in the back, which help neck pain, teeth. I've done TMJ. We do TMJ. I've done every joint in the body practically. You can do the spine, the facets in the spine. You can do knees, ankles, toes, hands, wrists, elbows, shoulders. I've done practically all the joints.
Okay, cool. And so I know that you also offer, and I haven't taken advantage of this yet, but you also offer IV ozone. So tell me about that.
Yeah, we do the IV ozone, and that's where we actually take out a certain amount of your blood, and then we mix it with the ozone. And again, we infuse it in 30 minutes because at that point, then the O3 molecule, which is the ozone, can break off into actually 2 molecules of oxygen. So, you're getting oxygenated systemically. It's very, very good for chronic pain, all kinds of infections. We have different levels that we do it at. We can do it at a level that's more for just oxidative therapy, where, it's just to make you feel good, boost your body up. We can do it to kill things at a much higher gamma, such as viruses, bacteria, fungus, just all kinds of organisms, protozoas, all that. So we use it for that. It helps with rheumatoid arthritis. We've used it for that. It's just amazing. I put a lot of my patients on those routinely. I use it myself when I fly because I see so many people that come back from a flight who are sick. And as you know, the air's not very well filtered. And so I use it before I go on a flight to help me ward off infection, and then I use it when I come back. And it does tend to help thin the blood a little bit. And as you know, a lot of people are having pulmonary embolisms when they fly. So it's a great thing for me. And the thing about it that I really love is it only takes about 30 minutes to infuse, 20 to 30 minutes. So it's really fast, quick, and you get just great results.
That's amazing. So, I guess, you do traditional medical practice in the Medical Healing Center. I mean, there's an MD there. And so you do the traditional stuff, but you've got a full complement of alternative solutions that I've never heard of before. And I got to say, I was blown away to find this in Tallahassee, Florida, little bitty Tallahassee, Florida, Yeah. So what are some of the other alternative solutions that you guys offer?
We do the QXCI or SCIO, which is it's a form of biofeedback. And we can actually look at over 9,000 different things in the body. And we send in energies that react with amperage and voltage and comes back in to the computer, and it calculates. So we can look at things that lab tests can't look at. We can look at toxic exposure, pathogens that aren't being picked up. We can look at, 9,000 different things, toxicities. We can look at organs, and then the machine actually goes back in and it balances energetically or detoxes or can kill with energetic frequencies organisms. So that's one modality. We do functional medicine. Dr. Ola, she's trained by the International Society of Functional Medicine as a functional medicine doctor. So she does functional medicine. She actually does prolozone as well. She was trained by Dr. Robert Rowan out of California. We do all kinds of infusions. We do high-dose IVC. We do nutrients. We do hydrogen peroxide. I just can go on. A lot of different combination IVs. IVs for hydration. We've done a lot of those this summer. We do the Myers cocktail.
What's that?
The Myers cocktail is like a nutrient vitamin IV, and it's for fatigue. We can do an IV for anxiety, for, like if people are having palpitations, we can do an IV for that. We do wellness IVs, we do anti-aging IVs, so we just do a lot of IVs.
Okay.
And we get a really good response with it. So people are very happy.
I've noticed when I've been there that a lot of people who are undergoing treatment for cancer come to you for these IV treatments to support them as they're going through their cancer treatment. How does that work?
We actually give them nutrients, and we can also, with a lot of the chemos these days, you can do the IVC. So we'll use the high-dose IVC to augment the chemo.
Okay.
And so that's worked out very well. And we've also used the IV MAH, which is considered an alternative IV for chemo, too.
Okay. Now,
which is the Ozone, I'm sorry.
Okay, all right. So you're located in Tallahassee, Florida, but can you tell people, because I have a feeling, since this show is national and international, that there are going to be people who are going to be interested in talking to you, maybe even coming to Tallahassee. We do have an international airport here, kind of, sort of.
Yeah, that's true.
But Angela's center is called the Medical Healing Center, and the website is themedicalhealingcenter.com. And Angela, what is the phone number if they want to get in touch with you? Because all I can see is 850.
It's 850-309-1665.
Okay, and you also have a Facebook page. On Facebook, it's The Medical Healing Center on Facebook. So go there and like that, and you can, because Angela goes out periodically and does videos with information that can help each of us. They help me a lot to understand a different topic every time she comes on. So that's a real positive solution as well. But the thing I'm most excited about, Angela, is the Prolozone, because it has just been a miracle for me. Because I really do not want to undergo total knee replacement. And, everybody that meets me has always said, up until I started doing the Prolozone, has always said, boy, you really need to go get that knee replaced. You really need to go do that. And I'm like, no, I don't want to do that to my body. And we've been at it for over a year, and everything's just getting better now. So I'm assuming that it will continue to do so. I'm just gonna know that and own that.
Yeah, and we actually see people who have had knee replacements and joint replacements because they built up scar tissue around those areas that are repaired, and the Prolozone does help break down that scar tissue as well.
Okay. So if somebody had a knee replacement and they were dealing with adhesions and such as that, how long after the knee replacement would they need to wait before they could start the Prolozone?
I like for them to be cleared by their surgeon.
Okay.
Before they do anything.
That makes sense.
Yeah.
Okay. So are there any other little tidbits or tips that you would like to share with the viewers?
I'm not sure. Well, we do a lot of, like I said, functional medicine, and we do
explain that, because I don't understand that. What is functional medicine?
So functional medicine is where we look at the functioning of the body, the way that it's supposed to be, and the idea is to get everybody's body back working to their optimal functioning level. If you do that, then you can get rid of illness of any kind. And so that's our goal, and we do a lot of that. We also do integrative, so we can do the traditional as well, but a lot of our clients like the functional medicine because we'll be dealing with, like, if they have a dysfunction in their digestive tract, it could be like a neurological dysfunction, but we do test to actually look at the dysfunctions, and then we go back in and we use herbs, homeopathic supplementations, vitamins, nutrients, IVs, sometimes depending on what it is. Mm-hmm. And so that's what we do, and we get rid of illness that way. The body's really made to be healthy and perfect, and it's amazing how when we're functioning at our optimal level, we can get rid of a lot of things, like most things.
Yeah, and I've always told my clients and on my shows, I've been really adamant about the fact that the body will heal itself if we get out of the way, if we stop doing the negative and let it do what it's supposed to do and not cut on it and all that.
Exactly.
It will heal itself, and it's designed to do that.
It really is, and illness is a call for help from the body.
Right. Exactly. Well, this has really been exciting, and I really appreciate you taking the time out this evening to join us and to share about this, because this is truly life-changing stuff, folks. So go check out her website, themedicalhealingcenter.com, and see what you think. And if you want to talk to me about it, if you want to hear about my experience, email me, Jean@JeanAdrienne.com. I'm happy to share what my experience has been, because you don't have to suffer. You don't need to be in pain. Mm-hmm. There are ways to get around this, and to get around this in a healthy manner, not necessarily a surgical manner, and not by taking drugs. And which is what I'm all about. The more natural that we can be, the better off we are. So thank you, Angela.
Thank you, Jean. This has been a pleasure.
No, my pleasure, totally. Viewers, now we're going to be off the air for the next 3 weeks. I leave on Monday for Turkey, and so I'll be on a plane next Monday night. I'll be in Turkey, which is like 8 hours ahead, so it'll be like 3 o'clock in the morning. So I'm going to be doing this then. And then the following Monday, I'm on a plane coming home. So we're going to be 3 weeks without a show, but we will be back. I've got some great shows online for you when I return. And until that time, remember, people who take responsibility for their lives create the reality they desire. I love you all, and thank you so much for supporting Power Talk. Ciao.
Thank you.